Hi, I'm Mara Flor Kinatadkan presenting Dengue Awareness, which is also include the causes, symptoms, and treatments. The main focus are the overview of dengue virus, what type of vaccine the dengue vaccine is, when to get vaccine, how many doses to get fully vaccinated, and what are the complications if vaccines are not given. Let's begin. Dengue is prevalent during rainy season because mosquitoes are active during this season. Dengue virus is a mosquito-borne viral disease that has been rapidly spread in tropical area. It is transmitted by female mosquitoes because only the female mosquitoes feed the human blood, mainly the species of Aedes aegypti and a lesser extent of Aedes albopictus. The dengue virus can be transmitted by a mosquito who bite a patient who has dengue. The mosquito can become infectious when they carry dengue virus and inject them into another individual during its next meal. Take note that dengue doesn't spread directly from one patient to another. Once the mosquito has bitten the individual, the incubation period of dengue is 4 to 10 days. Positive and dengue shows the symptoms of high fever, muscle pain, vomiting, skin rashes, pain behind eyes, headaches, bleeding from mouth and nose. Another thing is low platelet count is one symptom that is specific to dengue. The only vaccine approved for dengue is known as dengue vaccine. However, there is a problem with dengue vaccine. Before that, let us first identify what type of vaccine the dengue vaccine is. It is proven that the dengue vaccine is a tetravalent live attenuated vaccine which uses a weakened form of virus that causes a disease, and they help prevent and create long-term immune response to our body. Like other vaccine, it was constructed using recombinant DNA technology and uses the genetic sequences from 4 dengue virus serotypes. Take notes that dengue vaccine is not for everybody who wants and willing to get vaccinated. It can only be given to individuals who have already been infected with dengue before. It is called seropositive. In further explanation, a non-vaccinated seronegative individual, which is someone who has never been infected with dengue or vaccinated before, may get a mild disease when infected or might never become infected with dengue in their lifetime. A non-vaccinated seropositive individual, which is someone who has been infected with dengue but has not been vaccinated before, will already have a mild disease during primary infection. Similarly, a vaccinated seronegative individual, which is someone who has never been infected with dengue but has been vaccinated before, is equivalent to having already had their first mild infection. Therefore, when these two individuals are infected with another types of dengue virus during secondary infections, they have the same amount of risk for severe disease due to antibody-dependent enhancement. On the other hand, a vaccinated seropositive individual, which is someone who has been infected with dengue and vaccinated, will already have their first mild infection plus protection against secondary infection. Therefore, when this individual is infected with other types of dengue virus during secondary infection, no disease or only a mild disease will occur. Even if the protection of dengue vaccine is incomplete towards all types of dengue viruses, a vaccinated seropositive individual has no additional risk to severe secondary disease, only reduced risk. This is why dengue vaccine is intended only for this group of individuals. That intended only for those individuals who considered as seropositive. To continue, how many doses are required to get fully vaccinated? The dengue vaccine requires 3 doses administered subcutaneously and given 6 months apart for full protection. 0.5 ml per dose are required. Lastly, let's talk about prevention of dengue. Water is where all mosquitoes breed, therefore we can stop mosquitoes from breeding by keeping the environment dry and clean. For further information, please look for my references. Keep safe, everyone. Thank you for watching.